So the video I watched involved a transgender male seeking care at a medical clinic. The patient was born a female named Josephine, but now goes by Joe and uses he, him, his pronouns. The scenario begins as the front desk staff of the clinic calls out the name Josephine, despite Joe identifying on his intake paperwork that he prefers to be addressed as Joe. He does attempt to correct this error and calmly speaks to the front desk staff. However, he is met with confusion, almost as if the front desk staff has never helped or treated a transgendered person before. She was also dismissive of his request to use his preferred name and does not apologize for her error. Although she says she will speak to the office administrator, she makes no attempt to speak to other staff members to try and rectify the situation at that time. This leads to the tech also using the wrong pronouns, calling out Mrs. Ramirez. The tech does apologize when Joe points out the error, but also appears flustered and uncomfortable when Joe corrects him. We see the tech's further confusion with the scenario when he speaks to the nurse privately, stating he doesn't know what's going on, making it very evident that many of the staff members of this clinic are not comfortable with or knowledgeable about transgender identification or care. The nurse is actually the first person to ask Joe how he prefers to be addressed and sincerely apologizes for the discrepancy. She also acknowledges the need for more education and training for the staff, and also points out the limitations of their EHR system when it comes to gender affirming care. She does assure Joe that they will provide non-discriminatory and patient-centered care. However, Joe remains wary of continuing the visit. Joel points out that the burden of educating providers and healthcare staff on transgender care often falls on the transgender individual, which he is understandably tired of having to carry. The lack of transgender or cultural competency exhibited by some of the staff also does not instill confidence that the practice can provide high quality, individualized care for the transgender community. So with that, the bioethical principle I chose to focus on in this scenario is the ethical principle of justice. Justice in healthcare requires the fair and equitable treatment of any individual, regardless of their age, ability to pay, gender identity, sexual orientation, race, religion, education level, to name just a few. For the transgender community, justice demands the same level of care, the same quality of care, and the same access to care as anyone else, with respect and without discrimination. It is evident that in this scenario, the care Joe is receiving is not just. The clinic is not equipped or well educated on the treatment of transgender individuals, limiting the ability of the staff to provide quality care and ultimately leaving Joe feeling disrespected. I wish I could say that I haven't witnessed similar scenarios at work or in clinical. However, I have, especially in the current political climate where the transgender community is facing a lot of stigma, harassment, honestly, blatant hate. I think we as healthcare providers need to do a better job of educating ourselves on the needs and best practices of this community to provide competent and respectful care. The transgender community does face some unique barriers to healthcare, including discrimination, lack of cultural competence, inappropriate EHRs and forms, and clinical facilities. However, a study done in 2017 by Safer et al. Reported the largest barrier to care for this community is lack of access due to the lack of experienced and knowledgeable providers offering care to transgender individuals. To strive for justice in healthcare for this community, I think this is where providers and clinics should focus. In terms of the specific ethical dilemma with Joe and the clinic, I feel the nurse did a good job speaking to Joe about the lack of cultural competency he experienced from certain staff members, and she apologized. She made sure he felt respected and supported in his decision to continue or not to continue the visit, as well as voice any feelings of discomfort he might have. I do think it would also warrant a private conversation with the front desk clerk and the tech on how to better communicate with both the patients and each other so as to avoid a similar situation from occurring again. On a systems level, I think regular mandatory education sessions for all staff would be a great place to start. Klein et al. Writes in 2018 issue of American Family Physician that training staff and providers in culturally sensitive terminology and topics, as well as learning how to assess their own internal biases, can help improve patient interactions. The clinic in this specific scenario does implement staff education at the end of the video. Klein et al. Also emphasizes the importance of fostering a welcoming environment by offering transgender-friendly materials in the waiting room, making sure intake forms use gender-neutral language and ask for both sex assigned at birth and gender identity, updating EHR systems to be more inclusive to this community, as well as having transgender resources available is all important. When it comes to medical care, I also think it would be prudent to offer providers training on gender affirming care so they can feel confident when offering hormone therapy or discussing surgical options, and also just providing preventative screenings for this community, as it is often not taught in schools, and therefore we now have a lack of access to it. That is all I have, and I will list my references below. Thank you.